So I'm here with Dr. David Bell, who's a public health physician, epidemiologist and former medical officer at the World Health Organization. Thanks for chatting with me, David.
Thanks, George.
Now, we've recently had confirmed cases of the highly pathogenic H5 bird flu strain in Australia. How concerned should we be about this?
Yes, it's H5N1 is highly pathogenic to birds, but not to humans. This is a virus that's probably been around as long as birds. We've known about it since the 1990s as a specific strain. It's in Asia, it's in North America, Europe, etc. It's North America as an example. Perhaps it was implicated in about 3 deaths over the last 5 years or so, according to CDC. So it's a very benign virus in terms of humans. There's no evidence of sustained human-to-human transmission. It's a problem in birds. It's part of nature. So it's spread by wild bird populations. The worry really is not the danger to humans, because there's no record of a severe outbreak in humans of any sort, despite decades and decades of circulation that we know of. The worry is really the response. So in other parts of the world, they've culled chickens, and they've culled millions of chickens, destroyed chicken farmers' livelihoods, damaged the economy, increased the price of food, etc. for people who are struggling to pay for food already. And there's no evidence that any of this has made any difference in terms of containing the virus, because it's spread naturally through bird populations. It's a natural part of the ecology of wild birds. So really, it makes sense to know it exists, and if there's a lot of chickens die, then you would limit people going within that chicken farm, because there's a theoretical possibility that if you're already sick, you have a poor immune system, and you're in the presence of a lot of infected chickens, you might get sick yourself. But you're not going to spread it to other people. You're not going to start a spread within a community. So if a chicken farm has a large die-off, you might quarantine that farm for a while until the resilient birds, which will survive, which will be a large proportion of them, are left there, and the dead birds that are going to die are dead. And then you go on with life, and the farmer still has his chicken flock, he still has his livelihood, and there is no harm to the human population. So we've seen, this is on top of a hantavirus that killed 2, perhaps 3 people on a ship, and that's a very normal virus. WHO records thousands and thousands of cases around the world, but it was blown up in the media into a huge deal. Nipah virus before that, again, this is something that's been around for thousands of years in the human population in certain parts of Asia, probably, and kills very few people. We've had Mpox before that. There's the Ebola outbreak in DRC at the moment. None of these in any way are likely to cause any major outbreak globally. They are and have always been isolated outbreaks in animal populations or in human populations where there's specific characteristics, like Ebola. There's a civil war going on, there's a very poor health service, there's a high distrust of the health service, and there's very poor people with poor health service access. So, and there's funerary practices there. So that is why Ebola is happening in the province, Ituri province in DRC. Though none of those conditions for Ebola transmission exist in Western countries, it will never spread to Western countries. If you get one case, it's obvious Ebola, you can only get it by very close contact, as an example. So the current thing with H5N1, is that it's part of this thing, this effort we're seeing to sort of stir up a lot of anxiety, a lot of fear around outbreaks, and there's a whole industry out there which is being paid to do this because it's their livelihoods to work on outbreaks. We've developed this over the last few years since COVID. They need to keep these outbreaks going in the public's mind to justify their own existence. and they will very likely, unfortunately, implement responses which have no evidence base, but which will make it look as if they're useful. So this is it's something which we're seeing on a global scale. It's something we're seeing on a local scale here. It's not good public health. It's harmful. It diverts resources from things that matter, and it's something that somehow we have to get on top of, because we have to stop this constant fear mongering. In the 1970s, 1980s, 1990s, we didn't have this. Same people, same world, same ecology, but we didn't have this constant fear mongering. Now that we can print vaccines very quickly, there's a very strong financial incentive from very large multinational corporations to push this, and they've essentially taken over a large part of public health.
Thank you for your time today, Dr. Bell.
Thank you.
I appreciate it.